Let's talk about epidemiology. Tetanus is a global infectious disease and it is majorly prevalent in regions of the world, developing regions of the world, where immunizations or vaccination programs are very poor and wound management is also very ineffective. There's a high incidence of tetanus in sub-Saharan Africa as well as in South Asia. Developing countries report fewer cases of tetanus as a result of more robust and more effective vaccination programs. Neonatal tetanus contributes a greater amount of deaths, of tetanus-related deaths in endemic regions. The mortality rates of tetanus is above 50%, especially when severe in untreated cases. But recently, the global tetanus death has significantly reduced due to more effective vaccination and immunization programs and also more effective wound management practices. There are certain risk factors that predispose an individual to developing or getting infected with tetanus. These risk factors are individual risk factors as well as environmental and cultural risk factors. For the individual risk factors, we have lack of vaccination. Lack of vaccination cannot be emphasized because when the vaccine is not present, an individual is highly susceptible to getting infected with Clostridium tetani that can cause tetanus infection. Also, advanced age is another very important risk factor. Elderly individuals are more likely to get infected with tetanus because they have a weaker immune system as a result of wear and tear over the years. Also, neonates of unvaccinated mothers are highly at risk of getting infected with tetanus. This is because they don't have the protective passive antibodies that is present in the blood of vaccinated mothers. And sometimes contamination of the umbilical cord occurs during delivery, and this can serve as a means of infection with tetanus when the mother does not or is not vaccinated against tetanus. As part of the individual risk factors, individuals with burns, with wounds, with surgical injuries, etc., are also more prone to being infected with tetanus. For the environmental and cultural risk factors, there is poor sanitation, exposure to soil, to contaminated surfaces, to animal waste, etc., non-sterile circumcision, tattooing, piercings, exposure to unsafe home delivery practices as are all means or are all risk factors that can make an individual susceptible. Also, traditional wound treatment using contaminated surfaces all make an individual prone or susceptible to getting infected with tetanus. Diagnosis of tetanus. Tetanus is principally diagnosed using clinical diagnosis. What is clinical diagnosis? Clinical diagnosis is a form of diagnosing an infection, a disease condition, based off of signs and symptoms exhibited by patients rather than relying on laboratory investigation and imaging studies. Tetanus is usually diagnosed using signs and symptoms by the clinician or physician. And these signs and symptoms include trismus, which is known as lockjaw. Lockjaw. Lockjaw is basically the spasms experienced, the muscular spasms experienced in jaw muscles of affected individuals that are infected with tetanus. Other important symptoms include stiffness of neck, generalized muscle rigidity, facial grimacing, autonomic instability that is characterized by fever, sweating, as well as hypertension, painful muscle spasm that is triggered by light, triggered by noise as well. Laboratory investigation is not definitive for tetanus. However, tetanus is rarely diagnosed or rarely isolated via wounds. Wound swabs are cultured in cooked meat medium and then they are plated on blood agar, subcultured on more specific agar such as the PRO, YG agar. That is the pepton-rich yeast glucose agar. And then the isolates of after incubation from this agar are subjected to gram staining to figure out or to detect the presence of gram-positive bacilli, gram-positive rods. And then these isolates are subjected to biochemical testing to pinpoint the presence of Clostridium tetani bacterium. Prevention and control. The most effective preventive strategy against tetanus is vaccination. It cannot be overemphasized. The most popularly used vaccine include the DPT vaccine. The DPT vaccine, which means diphtheria, pertussis, tetanus vaccine. This vaccine offers protection against diphtheria, against pertussis or whooping cough, and against tetanus. And it is usually given to infants after 6 weeks of delivery, given to individuals after every 10 years to reenact antibody protection. And also it is given to pregnant women to offer protection against neonatal tetanus. Other preventive strategies include wound care. Wound care is very important. Immediate cleansing and debridement of wound. Debridement involves removal of dead or contaminated tissues in order to allow for the potential healing of more healthy tissues. Also, the use of antiseptics to wash the surface of wound is very important. Avoidance of traditional wound treatment practices with contaminated materials. Public health education is also very, very pivotal as it educates and enlightens the masses on the importance and efficacy of vaccines. Organization of vaccination programs as well as surveillance programs is very essential as a preventive and control strategy against tetanus. Treatment. Tetanus is a medical emergency and it requires urgent hospitalization as well as intensive care. The treatment of tetanus has specific objectives, which include elimination of the circulating toxin, neutralizing of the circulating toxin, elimination of bacterium, that is Clostridium tetani, as well as managing autonomic instability and controlling muscle spasms. In order to neutralize the toxin, that is tetanus plasmin and tetanus toxin, the most common antitoxin used is the tetanus immune globulin. Immune Tetanus immune globulin. This is the most popularly used TIG. This is the most popularly used antitoxin to neutralize the tetanus plasmin and tetanus toxin. This is the most popularly used antitoxin to neutralize the tetanus plasmin and tetanus toxin that is being released or that causes the clinical manifestation of tetanus. In order to eliminate the bacterium, certain antibiotics are used, the primary of which is metronidazole, and then alternatively, penicillin G is also used to neutralize Clostridium tetani. In managing muscle spasms, certain muscle relaxants are used to cause muscle relaxation and impede and inhibit continuous muscle contraction that leads to muscular stiffness and rigidity. The most commonly used muscle relaxants are diazepam and diazepam, diazepam and baclofen. So these are the most commonly used muscle relaxants to inhibit muscle rigidity and stiffness that is caused by tetanus.